During the trial of Lucy Letby, one piece of medical evidence drew particular attention. Two infants in the neonatal unit suddenly deteriorated. Blood tests later revealed extremely high insulin levels. But according to hospital records, neither child had been prescribed insulin as part of their treatment. For investigators, this raised an immediate question. If the insulin was not part of their care, where had it come from? When doctors examined the blood test results, they noticed something unusual. Insulin levels were extremely high, but another hormone that normally appears alongside insulin, known as C-peptide, remained low. In medical testing, that combination can suggest the presence of synthetic insulin. Insulin plays a critical role in regulating blood sugar levels in the body. When insulin levels rise suddenly, blood glucose can drop quickly. In adults, this can cause dizziness, confusion, or loss of consciousness. In premature or medically fragile infants, the effects can be far more severe. Even a small disruption in blood sugar levels can lead to rapid deterioration, requiring immediate medical intervention. Because of this, unexplained insulin readings in neonatal patients are treated as extremely serious events that require careful investigation. For investigators reviewing the case, those results raise an obvious question. If the infants had not been prescribed insulin, how had it entered their bloodstream? Expert witnesses for the prosecution told the court that this pattern was unlikely to occur naturally. They argued the results pointed toward insulin being administered deliberately. For investigators, the insulin findings became an important part of the timeline. Several of the babies involved in the incidents had previously been stable. Then, without warning, their condition deteriorated. If insulin had been introduced into the bloodstream, it could rapidly lower blood sugar levels. In fragile neonatal patients, that kind of change can become life-threatening very quickly. The prosecution presented charts showing when the collapses occurred and which staff members were working at the time. According to their analysis, Lucy Letby was present during many of those incidents. The defense challenged how the medical evidence was interpreted. They argued neonatal medicine is extremely complex. Laboratory results, particularly in premature or critically ill infants, can sometimes produce unexpected readings. The defense also questioned whether the insulin test results alone could explain the collapses described in court. They suggested that other medical factors may not have been fully explored. In their view, the prosecution's argument relied heavily on interpretation rather than direct observation. Even after the verdict, the insulin evidence remains one of the most discussed aspects of the trial. Supporters of the conviction argue the laboratory results are difficult to explain in any other way. Others believe that complex medical cases require careful scrutiny of expert interpretation. Appeals in cases involving technical evidence often focus on exactly these issues: how the evidence was presented, how it was interpreted, and whether alternative explanations were adequately considered. The Lucy Letby trial lasted nearly 10 months and involved thousands of pages of medical records. For the jury, the insulin findings formed part of a much larger body of evidence. But outside the courtroom, the discussion continues. And as appeals move forward, the role of that medical evidence may remain a central question.